The proposed Right to Reproductive Freedom Amendment to Michigan's Constitution is a wolf in sheep's clothing. The proposal was circulated and sponsored by Planned Parenthood, and it threatens to change Michigan's Constitution to make abortion legal until birth and allow abortions and sterilizations for minors without parental consent. The proposal would affect over 25 laws that are already in place to protect women, protect unborn children, and prevent taxpayer-funded abortions.
The ballot proposal rides on the violent swell of progressive reaction to the Supreme Court's Dobbs decision, which overturned Roe v. Wade, Planned Parenthood v. Casey, and decades of federal court restrictions on state law regulating abortion. You may have heard some of the claimed benefits of the amendment. Protect miscarriage care, protect women, don't take away the right to choose. My body, my choice. Save Roe.
If you hear nothing else, know that the amendment does not restore the Roe status quo. Rather, it unwinds nearly all of Michigan's Roe and Casey compliant abortion regulations and leaves Michigan's legislators virtually powerless to regulate abortion, sterilization, and gender transition therapy.
Under Roe and Casey, Michigan's laws require parental consent for minors, require safe care, and limited elective abortion to pre-viability. The amendment changes all this and much more. Elective abortion always harms women. Elective abortion is always an act of violence against the most vulnerable. It always ends the life of a child, a human being that is unrepeatable, created in the image and likeness of God, body and soul from the moment of conception, with a unique genomic sequence, personality, and God-given mission. This hardline Catholic perspective is not the subject of this presentation, but instead, let's turn to the claims made by the amendment proponents.
They claim the amendment restores women's rights under Roe. False. This amendment is so far beyond Roe that it cannot be fully explained in one sitting. Take this one direct quote, for example. The state may regulate the provision of abortion care after fetal viability, provided that in no circumstances shall the state prohibit an abortion that, in the professional judgment of an attending healthcare professional, is medically indicated to protect the life or physical or mental health of the pregnant individual. It's important to know that this text will not be on November's ballot. You will not see it. You need to look it up for yourself. The text of the amendment is not a loophole. Court interpretation of Michigan's Constitution relies on the text and common definitions of the words used. These definitions you will not see on November's ballot. Unless the amendment is defeated, abortion will be legal in Michigan up to birth under the physical or mental health exception.
As any woman knows, a normal, healthy delivery is a risk to the mother's physical health. Obstetric emergencies like severe bleeding and an amniotic fluid embolism can even cause death during delivery. If a determination is made that an abortion will protect a mother from this danger to her physical health, then the abortion is permissible. Also, since healthcare professionals include a wide variety of professions, the mental health or physical health determination could be made by a nurse or a social worker, among others. Nothing in the text indicates that the same healthcare professional who makes the determination must be the one who performs the abortion.
Therefore, a referral network of psychologists or social workers to abortion physicians could further insulate providers from laws against post-viability abortion. The plain text here says that abortion will be legal until birth in Michigan. This is not a return to Roe.
Number 2, the amendment preserves the rights of the next generation. False. Parents are essential to the formation of their minor children. It is necessary that children be counseled by their parents regarding life-altering medical decisions. This counseling is a right for both parents and children. However, the amendment clearly provides that a minor girl can seek and obtain an abortion without parental knowledge or consent. The amendment further provides that a minor boy or girl can seek and obtain permanent sterilization or hormone therapy without parental consent or knowledge.
Every individual has a fundamental right to reproductive freedom, which entails the right to make and effectuate decisions about all matters relating to pregnancy. This is the amendment text, again, which you will not see. This right includes, but is not limited to, prenatal care, childbirth, postpartum care, contraception, sterilization, abortion care, miscarriage management, and infertility care. The state shall not discriminate in the protection or enforcement of this fundamental right. This amendment text means that no discrimination on the basis of age can occur. Care could include secret treatment of gender-confused children that results in hormonal sterilization. Such treatment is likely to have permanent harmful effects, especially in prepubescent minors. The amendment is a direct attack on the rights of Michigan parents and children.
Number 3, the amendment protects a woman's right to choose. False. Medical professionals have the duty to provide detailed information of risk versus benefits to patients in order for them to make an informed decision regarding medical and/or surgical treatments. Providing this information allows for an informed consent. However, the amendment reduces the consent threshold from informed to voluntary. Voluntary consent merely means that there is no coercion or deceit on the part of the practitioner. A woman cannot freely choose an abortion until she is informed. She should be informed of the fundamental risks that are associated with abortion, and that certain risks are higher during an abortion procedure than during childbirth.
Further, the amendment would not allow patients to sue in malpractice against a physician who failed to inform them of the significant health risks posed by an abortion or sterilization procedure. The physician has a clear defense under the text of the amendment itself. The amendment protects physicians, not a woman's right to make informed choices. Claim 4. The amendment protects miscarriage care. False. A patient would never be punished for having an involuntary miscarriage or a stillbirth, even under Michigan's 1931 law that is currently in litigation. Miscarriage and stillbirth are medical situations in which the unborn child dies spontaneously.
Miscarriage refers to a death before 20 weeks, and stillbirth occurs at 20 weeks or more of gestation. The term stillbirth also refers to fetal death during birth. Women will always be able to receive medical care for miscarriage or stillbirth under current law, as the mother did not intend to end the life of the child in the womb.
The amendment does nothing to protect miscarriage care. It merely hides abortion care under this false mantle.
Number 5. The amendment allows medical treatment for an ectopic pregnancy. False. An ectopic pregnancy is a medical emergency, and women are always able to receive medical care in this situation. An ectopic pregnancy is defined as an extrauterine pregnancy in which the baby is found outside of the uterus. The treatment approach can be different depending on whether the fetus has already died or not, the size of the baby, and if the mother is stable or not, and her ability to seek medical care in case of an emergency. Most ectopic pregnancies occur in the fallopian tube, but other possible sites include the cervix, the scar from a previous C-section, the ovaries, or the abdominal cavity, among other places. Having an ectopic pregnancy places the mother at risk of dying from hemorrhaging if the area will rupture. Women are receiving and will always receive care for an ectopic pregnancy, which is a life-saving treatment for the mother.
The amendment does not create any new protection for treatment of an ectopic pregnancy. It is an abortion amendment. Number 6, the amendment protects healthcare professionals from going to prison for performing vital fertility, miscarriage, and pregnancy services. This is false. No law Not even the 1931 statute that is currently in dispute in the courts prevents doctors from providing these services. The 1931 law makes elective abortions illegal, and a doctor who performs an elective abortion would be guilty of a crime and could be threatened with prison. Current Michigan law allows care for spontaneous miscarriage, fertility, or pregnancy services. Claim 7. The amendment prevents prosecution of doctors for performing abortions where the mother's life is at risk. False. This protection is already enshrined in Michigan's laws. The protection appears in multiple statutes, even the 1931 law. The amendment text goes far beyond Roe-era statutes. It provides that no, quote, healthcare professional can have an adverse action taken against them for aiding or assisting in the exercise of reproductive freedom. This is a radical increase in protection from regulation, since the amendment states that no pre-viability law can, quote, infringe on that individual's autonomous decision-making. How will Michigan legislate against or prosecute the next Kermit Gosnell when the law must bow to the autonomous decision-making of patients?
Number 8. This amendment is needed to prevent healthcare professionals from going to prison for providing abortion care. Mostly false. Under current law, licensed physicians can perform abortions in certain circumstances. The amendment does not restrict abortion care to physicians. The amendment uses the term healthcare professionals, which in Michigan include acupuncturists, athletic trainers, audiologists, chiropractors, dentists, dietitians, family therapists, massage therapists, nurses, social workers, veterinarians, among other professionals. The amendment is unclear whether such persons could actually perform abortions. However, it is abundantly clear that these professionals can decide whether a third trimester fetus is viable.
If, in the unreviewable judgment of one of these healthcare professionals, the fetus is not viable, then an abortion could be obtained even up till birth.
Number 9. The amendment protects women. False. This amendment will invalidate state laws that require abortion clinics to meet the same basic safety standards as other healthcare facilities, such as hospitals and outpatient surgery centers.
Under the amendment, no law can be enacted regarding safety standards if that law, quote, infringes on that individual's autonomous decision-making during pre-viability. This means that no law can prevent a woman from seeking cheap back-alley abortions from an unlicensed physician. This may sound radical. It is. Claim 10. The amendment protects the fundamental right of every individual, man and woman, over their own body, as summarized in My Body, My Choice. False. The amendment only recognizes the right of bodily autonomy of the pregnant woman, not the bodily autonomy of the male or female individual in the womb. No right is absolute. Every right under the Constitution and other laws must be seen in relation to the rights of other individuals. For example, the right to freedom from police searches. It's not absolute. There are circumstances when our cars, our homes, and even our bodily cavities may be searched to protect the rights of other persons. Even our right to our own life must give way when our country is at war and needs to draft troops. Simpler rights, like the right to put up a fence on one's own property, must give way to the rights of your neighbors not to have the free flow of air and light obstructed on their property.
Even though a person has a right to make their own medical decisions, like refuse medications, surgeries, infusions, and life-saving medical treatment, there are few circumstances where these decisions could infringe on the rights of a second person, and pregnancy is such a case.
Imagine a woman who's at home watching television and a male friend stops over with an infant daughter, ostensibly to say hello and chat for a while. The man excuses himself to the bathroom, but then disappears, leaving the home. The woman tries in vain to contact him, but is left alone, holding a baby that she did not ask for. Ordinarily, the woman has rights in her own home, to deny anyone entry, to ask anyone to leave, and even to kill an intruder who threatens her. But what are her rights here with respect to this child? Specifically, can she kill it and dispose of the body? In this case, the rights of the woman must give way to the rights of the baby girl. Obviously, this metaphor breaks down, as all do, because there is no risk to the physical integrity of the home when police come to pick up the child, and there will be only a few minutes before the situation is resolved. Nevertheless, the metaphor is informative. As a society, we must find a way to balance the rights of the woman with the rights of her unborn child, just as we have learned to balance the rights of Americans with conflicting rights in all other contexts.
Many people have become confused about this balancing exercise because they are confused about the following. The child is not part of a pregnant woman, the child is not a parasite, and the child does not have its own rights. We must start with the first premise. The pregnant woman and the child are not the same being, entity, person. The fetus or preborn baby is not part of a woman's body. A woman's body does not have 2 heads, 4 arms, and 4 legs. The pregnant woman's body is a separate entity from an unborn child, both human beings from the same species, the Homo sapiens sapiens, but with a distinct genomic sequence that distinguishes the 2 completely different organisms with 2 different bodies, living in a mutualistic symbiotic way. The preborn baby has his own or her own heart and brain and organs. If the pregnant mother dies, her child can still live if quickly removed from her body, and could live without depending on the mother if the baby has reached a certain gestational age, currently about 21 weeks. Human beings can be dependent at any developmental stage. Preborn babies, newborns, infants, toddlers, adolescents, many aging adults, and anyone with cognitive or physical disabilities all depend on someone else for nutrition and care. Dependency does not make us less human. The baby is dependent on the mother for oxygen, water, nutrients, and all the needs in utero, just like an astronaut is totally dependent on a spacecraft for air, water, and food, and cannot survive in space. But that does not make the astronaut part of the spaceship. Although dependent, the baby is not a parasite. Pregnancy benefits the mother. Pregnancy is beautiful, amazing, and miraculous, as well as uncomfortable, unwieldy, and difficult. But the woman is not just a host. Studies have shown a multitude of positive benefits of pregnancy. For example, lower risk of breast cancer, ovarian, and endometrial cancer, reduced or eliminated menstrual cramps after pregnancy, reduced risk of developing a demyelinating event like those seen in multiple sclerosis. After birth, the oxytocin hormone helps with bonding, feelings of connection with the baby and with breastfeeding. And eventually breastfeeding the baby for at least 6 months can also decrease the risk of stroke, heart disease, diabetes, and high blood pressure. The pregnant woman has the capacity to nurture new life within her and almost effortlessly feed her child to help her or him grow until birth.
Any person, regardless of whether they are dependent on another, is worthy of protection from pain, abuse, and death. When a woman conceives, the new, completely dependent human being in her womb has the right to life. The amendment would allow abortion through pregnancy until birth, which is a tremendous mistake.
Elective abortion is not healthcare. It is the violent death of the unborn child. Abortion has serious inherent risk. A woman deserves to be fully informed. And we now know that induced abortions have been associated with an increased risk of infection, hemorrhaging, preterm birth, future miscarriages, infertility, cardiovascular disease, and even death. Abortion also has been shown to increase the risk of breast cancer, anxiety, depression, and suicide.
The amendment would allow minors to obtain hormonal sterilization and gender transition therapy without parental knowledge or consent. Children need their parents. Children need their parents, especially on gender and sexuality issues. Our culture of experimentation, promiscuity, and media bias has an obvious bent toward gender reversal. Our children should not be left without their parents in this storm of gender confusion.
Pregnant women and minors need healthcare professionals that provide ethical, life-affirming, high-quality, and evidence-based medical care. We need to provide support and legal protection to the expectant mother and her baby or babies. We do not need this amendment.
But don't just trust us on this. Read on your own, talk to others, make an informed decision before November 8th, 2022. Most importantly, know that the new text of our Michigan Constitution will not be written on the ballot for you to read. You need to read the text yourself in advance. There are and will be many articles providing contrary theories about what the text of the amendment means. Read those contrary theories as well, because you are a Michigander, and on November 8th, you are a legislator. What should your Constitution say?